This time we're gonna talk about the veins of the upper limb. Last time we talked about the arteries of the upper limb, and we knew that they begin with the axillary artery that goes through the axilla, and when the same artery arrives at the brachial region or the arm, it's called the brachial artery. So axillary artery to brachial artery, and then when it goes through the forearm, it branches into its two branches. We have an ulnar branch on the medial side and a radial branch on the lateral side. And then when they arrive at the level of the rest, they anastomose again through some branches that participate in the formation of the network on the palmar side and the dorsal side of the hand that supplies the whole hand with blood. For the veins, there's a group of veins which have the same names as the arteries that we mentioned right now. So they follow the same course, and there are usually two of them that accompany the artery. So for example, for the brachial artery, we have two brachial veins and so on. These veins are deep veins. And this group of veins is thin. We have another group of veins which is superficial. And these superficial veins are called so because they are subcutaneous. Subcutaneous means that they run directly below the skin and they are palpable, so you can feel them by touching the skin. So such group of superficial veins is wider than the deep veins, and of course all the veins will have valves to push the blood from the peripheries to the veins that they drain to. So we'll begin talking about the superficial veins. On the palmar side of the hand, so this is the palmar side and that one is the dorsal side. So palmar and dorsal. So on the palmar side, we'll see the veins will begin to ascend from the peripheries, from the level of, at the level of the distal phalanges. They will anastomose with each other and they will form arches, and then here at that region they will form a bigger arch, and this one is called the superficial palmar venous arch. The superficial palmar venous arch. This arch will give rise to a vein that ascends like this, and this vein is called the medial antebrachial vein. The medial antebrachial vein. Now we go to the dorsal side, we'll see something similar. We'll have the veins also ascending like this, and at the level of the dorsal side of the hand, here they form a corresponding arch, which is the dorsal venous arch. This arch will give rise to two very important veins. One of them will go laterally and the other one will go medially. So the one that goes laterally is called the cephalic vein. So cephalic vein, and the one that goes medially is called the basilic vein. The basilic vein. So these two veins will go from the dorsal side to the other side anteriorly, and we can see them like this. So they loop and go to the other side. So as this is the medial side, this will be the basilic vein, and this is the lateral side. This will be the cephalic vein. So we'll see here the medial antebrachial vein will give two branches here. And they are named according to the vein that they go to. So we have the median basilic vein and we have the median cephalic vein. And actually this happens maybe a little bit higher because this is the pattern that we see maybe here. This pattern, this M pattern, is the pattern which is used at the venous puncture at that point. So the puncture is done at that M pattern. And then both veins will continue its course. The basilic vein will drain into one of the brachial veins. So this will drain into brachial veins, the ones that accompany the brachial artery. And for the cephalic vein, it will penetrate, it will go into the deltoid groove. It will go into the deltoid groove, and then it will penetrate a fascia called the clavipectoral fascia. So it will course like this until it reaches the axillary vein at the axillary region, the vein that accompanies the axillary artery, and it will drain into it. Now we have to mention something important. For the basilic and the cephalic veins, when they go through the bicipital groove, one of them will go into the medial bicipital groove and the other one will go into the lateral bicipital groove, and then they will accompany the same elements that go into the groove, and they are the most superficial elements in the groove because they're superficial veins, as we mentioned in the beginning of the video. So these are the superficial veins, and as we mentioned, the deep veins will have the same names as the arteries of the upper limb. Both deep veins and superficial veins will communicate with each other through perforating veins, especially at the level of the hand. They also communicate with each other at the level of the forearm through the medial antebrachial veins, giving perforating branches and so on. So this is the venous structure of the upper limb. I hope it was clear for you, and see you next time.